Today we are bringing to you aesthetic beauty without tears. And our guest today is Dr. Yanni Van Logan, who is the Managing Director of Fall Clinic. Dr. Yanni, welcome to Majesty TV.
Thank you, Helen.
Thank
Apostle
you.
Helen.
Yes.
Happy Easter to you.
The same to you too. So we want our audience to relax and experience another version of our broadcast today. And then if they will want to tune in or follow this broadcast on the internet, they are also very, very free to connect with us and then ask their questions to Dr. Yanni. So I start by asking you, what really is the difference between aesthetic beauty and surgery?
That's a very good question. I think it's important to realize that there is a difference between plastic surgery
Yes.
and aesthetic medicine.
Yes.
A lot of people think that if you want to get a beauty improvement in your face or your body, that you have to go see a plastic surgeon.
Exactly.
But there is a relatively young medical field, and it's called aesthetic medicine. And I'm actually very proud that in the Netherlands, we're one of the first country that is upgrading this new medical field to a let's say new medical profile specialty.
Okay.
So next to specialties like plastic surgery and dermatology, there is now the birth of like this new medical profile specialty.
Okay.
And it's called aesthetic medicine.
Yes.
And we're actually the second country in the world that is getting this field to an official, let's say, nationally official status.
Okay. Really?
And what it entails is different from plastic surgery, because essentially plastic surgeons are trained to perform surgery.
Yes.
And the aesthetic doctors, the aesthetic medical doctors,
Yeah.
or the aesthetic physicians, they're actually trained to enhance beauty, but in a non-surgical way, so without the knife.
Exactly. And that is so beautiful because every woman out there will want to do something without a knife.
Yes.
So tell us, how does it work really? When you
So-
look at the face of a woman or the face of a man, how would you want to improve that?
So-
Improve the beauty in the life of that person?
So first of all, to the way to treat a woman and to treat a man is very different.
Okay.
Where a woman wants to be sexy and soft and with roundness in the face, and so the attractiveness of a woman is much different than from a man. A man wants to look strong and powerful and mysterious, and so the approach to a man is much different than
Really?
than
Mysterious?
yes.
Right.
Yes.
So he wants to be mature, strong.
Yes, and it's not so bad for a man to have some wrinkles. Actually, wrinkles in a man make him look quite interesting.
Really?
And whereas for a woman wants to look young, and so for most of my patients, they want to have a rejuvenation. Especially female patients, and the majority of my patients is a woman. I think it's 87% is female.
Yes. Because men wouldn't want to, men don't want to rejuvenate, is that?
Well, I think men are just a little bit less used to the fact that they can actually go to a clinic or go to a doctor to have something done in their face. First of all, because I'm a man, I know what I'm talking about.
Yeah.
I am a baby. Of course, I have some injections in my face, but I really don't like needles, and I really have to go like through a little,
Yeah.
psychological process before I dare to lay down and have an injection in my face. It's just so scary.
Really?
But now that I've experienced a few times, I realize that I'm still alive, and and that it's actually quite doable.
So interesting. Doctors don't like needles.
I love needles, but on the doctor's side of the needle.
Yeah.
And when I treat my patients, it's not painful at all for me.
Really?
For me, it's not painful.
Wow.
For the patient,
Because
maybe.
you are the one doing it, so you don't feel it. So tell us the latest in this aesthetic.
So the first thing I ask my patient is, okay, you want to improve your face.
Okay.
Do you want a natural improvement, or do you want to be visibly treated?
I love that question.
And then,
Natural and visibly. Visibly means it has to be very artificial, or what?
so let's say 99% of the people will say, no, 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 I don't want anybody to see that I've done something. I just want to look amazing. Okay, so you want a natural result. Yes. And then I will go through a whole consultation process where I try to find out what kind of person it is that it's in front of me. Sometimes people want to take it little baby steps at a time.
Yeah.
So we plan like different, treatment moments.
Mm-hmm.
Other people just want to get it over with. And so we do one big treatment, and then, we see each other after, a few months or something.
Okay.
But what I do is I look at the aging process mostly.
Okay. Aging process. Yes, that's good.
Yeah. So for making somebody look younger, it's an amazing process. For most people, aging is wrinkles in the skin.
Yeah.
But for me, it's in all the different tissues. There's not just the skin. There's the fat. There's the muscles. There's the ligaments. There's the bone. Everything changes. And so I have to make a diagnosis on what has changed in each individual that's in front of me, and to give a natural result.
Yeah.
I have to address all these little changes that I see, and so I have to make a treatment plan that is based on strategic placement of small quantities of products.
Wow.
And yeah, and so that way I can give my patients a natural result.
Really? Awesome. Awesome. So let's take the face. When you want to fill the face and make it look more younger, where do you start? Is it from here?
Yeah.
Or you start from here? Or do you do something here as well? Equipment, I don't know.
Absolutely.
And also here? So can you tell us a little bit about that?
So my specialty within the aesthetic medicine medical field is the global facial approach with injectables. That is really my specialty, and that's what I'm known for. So patients that are coming to see me are mostly interested in that treatment, because
what does that mean to a common person? Because global facial approach with injectables. Okay, so where are the areas you are putting the injectables?
So global facial approach means that I look at the face as a whole.
Yes, that's what it means.
So I don't necessarily treat only the lips or only some wrinkles.
Yeah.
I look at the face as a whole, and everything needs to be balanced. Because if you think about beauty and what makes a person look beautiful, is when all the elements of the face are in harmony with each other. And so the proportions are important. So if I treat only one part of the face, then I leave out other parts of the face. So there's no balance. I want to treat everywhere a little bit in order to enhance beauty.
So this is very important. So can somebody be aging without a harmonized face? Because you said you treat with harmony. That means things have to be harmonized.
Balanced.
It has to be balanced. So explain a little bit more to that.
Okay, so the aging process is affecting the whole face in all the different tissues. And it's not just the forehead. It's not just the mid face. It's not just the lower face. It's the whole face is aging.
Yeah.
So if I would treat only the upper face, then the upper face would become rejuvenated, and there would be a disbalance between the upper face and the lower face.
Yes.
And so that's what I mean. I prefer to treat the whole face instead of just parts of it. And it also means that I have to use different types of products and treatment modalities in order to assess all the different aging characteristics.
Yes.
There's a lot of volume loss
Volume loss. Yes, I heard that one time ago when you came.
Yeah, and so for the to treat volume loss, I have to give a volumizer. But there's also changes in skin. There's skin laxity. The skin is thinning, and so I have to use another product to treat that. There is like muscular hyperactivity, which means that the muscles are going to give more dynamic wrinkles, and in order to treat that, I use product to relax those muscles. So, based on the different aging characteristics, I use different modalities.
And to the men, the same treatment you give to the women, or the same injectables you give to women, is it the same you give to the men?
Well, with men, I use a lot of calcium hydroxylapatite, which is a product more known under the brand name Radiesse. I use that a lot. But I use that for women too. It's a little bit different, but the essential. Just compare it to an artist who makes paintings. He can use his palette of different colors to make all different types of paintings, right? So the different colors are my products, and so I can use those products for treating both men and women.
Yes.
Just I use them in a different way.
Wow. Awesome. This is so powerful. So now we are talking about the facial distance. There's another one you said is the top body treatment.
Top body treatment.
And then with a Brazilian butt lift. What do you mean by that?
So right now in the aesthetic world, there's a little shift going on.
I wish those women can come in and listen, because this is important to them too. Right.
So before we focused mostly on the face, but now the attention is shifting from the face also to the rest of the body.
Oh.
And so we have now a lot of attention to cellulite dimples. There's a new device called Selfina, and it can there's one treatment necessary, and there's long-term reduction of cellulite dimples, and especially the buttocks. And the buttocks are such a big focus. Everybody wants to have beautiful buttocks today.
So the cellular dimples are focused for the buttocks.
Yes, yes.
Really?
And the lower legs and the upper legs, yes. And the shape.
Is it that the women don't want the dimples anymore? Because is that what you are trying to make us? Please let the women come in. I think they will enjoy this broadcast. Is it that they don't like the dimples anymore? The women don't like the dimples anymore?
Well, I'm not sure if they ever liked them, but there's now this treatment possibility.
If they don't like the dimples, why is it that during the summer they are wearing all of these tight things to showcase the dimples, and you could see the really dimples? You could see them.
Oh yeah, they showcase the dimples?
Yeah, you don't know.
But okay, well, that's news for me.
So tell us about this treatment. Tell us about the Brazilian butt lift.
Yeah, so the one thing is the cellulite, but the other thing is the women like to have bigger buttocks and better shape of the buttocks. So what we do is using a liposuction technique with a special liposuction device, we take the fat from certain areas in the body where people kind of don't like to have the fat.
Yeah.
There's usually, if you ask any woman, she will probably have some area where she would prefer that there will be less fat.
Exactly. That's why I was thinking maybe they could have cooperated to say something. So I don't know why they are working in this manner, but it's okay. So what you are saying here is that
I take the fat from those areas.
The areas that, yes.
I collect it, I put it into syringes, and I re-inject it into an area that they want to have enhanced, like the breast or the buttocks.
So that means you can take a fat from my hand, because many women don't like this fat that comes here. So you can take a fat from here,
yes,
and then you can redirect it to another area.
Exactly.
Where it's needed.
Yes.
Wow, this is awesome. Is that not good news? I mean, every woman out there listening to this is coming to you live on Majesty Christian Television Network. We are here with the best doctor for aesthetic medicine. It's always the best we are getting for you people. We are talking about aesthetic medicine, improving your beauty and aging or beauty without tears. That's what we are discussing here, because in the past, women have been having difficulty in maintaining their beauty. They want to enhance their beauty, but it costs lots and lots of time and lots of operations, isn't it? But now, you are telling us that the thing has shifted from face, it has gone to the side of the buttocks. That's why we have a Brazilian butt. But what I do not understand, why do you people call it Brazilian buttocks?
It's just a marketing term.
Wow. Then call it Nigerian buttocks.
Nigerian buttocks.
Because we have Brazilian hair, Brazilian this, Brazilian that. So why Brazilian buttocks? The other time you came, Dr. Yani, you were talking about
Nigerian buttocks.
No, you were talking about the Lopex. Jello.
Yes.
Jello type of buttocks. And now it's now Brazilian. So tell us the advantages of that. Tell us why the name, and what are the differences, what are the different type of back sides that women can have, and in case they want to improve it, what are the things needed to be improved?
So as I said just now, we can take the fat from specific areas of the body and re-inject it into the buttocks, and that's what you would call Brazilian butt lift.
Okay.
But sometimes patients don't have enough fat to transplant.
They can't borrow.
So and then they come and ask me, well, my mom has enough fat. Can I bring my mom and can you inject the fat of my mom into my buttocks?
Yeah.
And I tell them no. That you can only inject your own fat back into your own tissue.
Oh, really?
Yes. But there are alternatives to fat injection. There are some hyaluronic acid gels that you can use for injecting into the body, and that is actually a temporary solution. But if you don't have enough fat in your body to transplant, that is actually the only way that you can do that. But most women have somewhere in their body an area that they don't mind where there's a little bit less fat.
Okay. What is the percentage you can pump from the areas where they want lesser fat? For instance, can you take fat from my breast?
I don't normally take fat from breasts.
Okay, but you can take fat from the thighs.
I usually take it from the legs,
Yes,
from the
because
thighs,
women
from the hips, and from
the hips.
From the
belly.
abdomen, and from the waist. Yes.
Wow. So when you take the one from the stomach, does it make the stomach now flat or what? Really?
Yeah, it makes it the layer of fat becomes thinner.
Thinner. Okay. Now, the lipofilling breast. What do you mean by that?
Well, it's the same basic principle. We take fat from somewhere where you don't want it, and instead of injecting it into the buttocks, we can also inject it into the breasts. And there's been a lot of attention for the dangers of breast implants. And the breast implants, silicone implants, are actually still the standard for people who want to increase the volume of their breasts. But there are, some problems that have been associated, and so we see now that because there's been some publications around those problems, that there's a lot of people who are actually looking for alternatives to silicone implants.
Yes.
And they find out that you can actually also inject your own fat into the breast, and there's the big advantage is that first of all it's your own tissue.
Yes.
So you're not going to have any, let's say, immune response to your own tissue. And secondly, the big advantage is that you're not only increasing the volume of your breasts, you're also reducing the fat volume in other places where you don't like to have.
Which is very good.
Yes.
Which is very good. But are there some cases where some women who have big breasts, because I've also seen women who have big breasts, they will want to have smaller breasts. Do you do such a thing?
Well,
and also there are women whose breasts are very flat. They want to, because the last time you told me you can make the flat, you can make the breast to stand like that of an apple. So these injections which you are giving, do they have the capacity?
Well, there's a limit in the type of breasts that I can treat
Yeah.
with lipofilling.
Yeah,
So
lipofilling, yeah.
it depends really on the situation of the individual patient. Um, if they're hanging too much,
Hanging.
or
That's the word you call it.
so then you need to yeah, then we need to then there's a surgical procedure necessary.
Okay.
Um, so yeah, depending on the situation of the patient, we have to see if it's necessary to use the lipofilling technique
Yeah.
to treat those breasts. Yes.
Well, let me just give the women who are in the studio one minute just to, in case there's an area they want to improve. Also, from the face to the breast and to the buttocks. Okay? The expert is here. Dr. Yane is one of the best. As a matter of fact, are you not the one who started this as aesthetic medicine here in the Netherlands?
I wasn't the first one.
Okay.
But I'm one of the one of the guys that are, you know,
Who are on top.
doing this work for a long time. Yeah.
That's true. Okay, because of your time, because we can see that you are a little bit under pressure now, we appreciate it. Can we just have 1 minute maybe for the ladies to ask?
Yes, absolutely.
Okay. So ladies,
there's a very young one.
yeah.
I have only one question for now.
Yeah.
This is in a hurry.
Yeah.
My question is, are there no like side effects to this? Like maybe you take from the stomach or the waist and put it on the butt. Are there no side effects?
Okay, so these are the question is, are there side effects? Definitely, there are possible side effects. This is kind of a surgical invasive procedure, and it's a very safe one, but the risks are not zero. So the risks are, first of all, scarring is possible, especially with a dark skin. Sometimes you can have like a keloid type reaction or a hypertrophic scar. Of course, the entry points that we make for the small cannulas, they're very thin. They're like 2.5 millimeters or 3 millimeters thick. So the incision is very small, but it could become a visible scar. Usually, the scars aren't very much of a problem. There is, of course, the risk of infection. It's a invasive procedure. There's an opening in the skin, and there's a possibility that a bacteria can go inside the tissue. Well, this needs to be prevented, and if it would occur, then it needs to be properly reacted upon. Then, of course, there's the possibility of having some kind of a bleeding. And there is the last possible complication is the temporary or maybe even permanent damage of nerves. And of course, we know now how to prevent all these possible complications. But I think it's important to talk about them. And during a consultation, we always talk about everything that could go wrong. And then we send people home to think about it if they really want to do this treatment, because the risk is never zero. These are medical treatments. There's always some, and it's a very small risk, but it's never zero. There's always some risk involved. And so a good explanation of the possible risk is definitely necessary to really make sure that you really want to do this treatment. It has definitely benefits. And looking at the risks, which are very low, then most people say, well, that's definitely worth the risk. And in my personal experience, I have never seen any serious side effects because of the development of the technique. It's so advanced now. We have a very good device that is collecting and harvesting the fat from let's say the belly. It has a spray. There's a water jet, and it sprays inside the fat, and there's anesthesia also inside, and it loosens up the fat cells from the tissue. And so it's a very soft technique compared to the more aggressive techniques in the past. So we don't need to use any force anymore, and that prevents a lot of problems.
Also, yes. Thank you so much. Doctor, another question, yes.
My name is Clara.
Yeah.
Hi, Clara.
So when there is an infection, it's assured that it will have a cure.
Yeah, so if you would have an infection, and fortunately that hasn't happened to me yet,
Yeah.
but it is of course possible, then antibiotic treatment is the treatment for an infection. And looking at the statistics, it's usually a bacteria that is usually living on the skin of the patient that somehow came inside the body and was allowed to multiply, and then there could be an infection. So the treatment for an infection would be antibiotic treatment. And we also give our patients usually for lipofilling prophylactic antibiotics. So half an hour before the treatment there's an IV drip, and we put some antibiotics into the IV just as a prophylactic treatment. Yeah.
And the surgery is lifetime.
It's not so, yeah.
Or
It's-
it has a
Yeah, so
variety of
after the treatment, there is compression. You have to have compression garments for 2 weeks, 24 hours a day. So it's tight, where you have been treated for the harvesting of the fat cells,
Oh, okay.
because we want the tissue to heal flat to the body. And then the 2 weeks after that, there is 12 hours a day of compression. And then in the beginning, there's some swelling. So if you would have it in your breast and you look at your breast and you think, wow, I hope it will stay like this. But slowly the swelling will go down. And so there's a reduction in result. But then
Awesome.
when there's, after about 6 weeks, you get then it is not really shrinking so much anymore. And that can be a permanent result. Yeah.
So because of time now, we're going to round up. But 1 second, when you are dealing with the face, and because you spoke about the muscles and the bones and the distance, so what then? How do you pump up this area? Are you going to do something to the bones to grow normal or to stop its reduction?
Well, unfortunately, we don't have any treatment yet
Yeah.
that will reverse bone resorption, because the bones in the face are becoming thinner and smaller. So
And that's why the face is collapsing.
yes, one of the reasons. And
Please look, have I collapsed?
oh no, you are perfect. You are perfect. Why are you laughing?
Dr. Yanni, you told me the other time, you said when you look at my face, you will see volumes. So please tell me volumes to work with. And now because of the ladies, you are not telling me the truth. May God help us. So about your treatment, are they very expensive or are they affordable?
Okay, so this is luxury. This is something extra.
Yes.
So these are, let's say, the medical treatments that are not going to be covered by medical insurances or anything. So
That's a good one.
These are all payable by
Yeah.
by the
By
patient.
individual, yes.
So for the lipofilling of the buttocks or the breasts, it's 3,950, and it's including 2 regions of liposuction. So it's a lot of money.
Yeah.
But you will have a very long-lasting result. And there is dieting alone is not going to fix it, because then you will lose fat everywhere.
Yeah.
So
This is good.
so a lot of people think it's worth the money.
Yes.
A lot of people will save up.
Yeah,
They will skip a vacation,
exactly.
because they know that if they do this treatment, and of course it's doing something to change the outside.
Yeah.
But the actual goal of the treatment is not to have a beautiful body, but it's actually to
Look
to
young.
feel confident and to
Yes,
feel good.
confident, exactly.
And if you look
That's
in the
the right
mirror,
word.
that you are happy with what you see.
Exactly, because many people are not confident, and because there are some people, you know, they have
Yeah.
too much of fat somewhere, and it's not making them comfortable.
No,
So,
they
if you
they
can regain your confidence, I think that is very, very okay.
it's such a boost, you know, if you look in the mirror and you think to yourself, you think, yeah, that looks good, you know, instead of, oh, I hate this and this and this, you know. So yeah, that's what it's about, to feel
Awesome,
good.
awesome. How may we reach you?
Well, there's a website.
Yes.
It's Falk Clinic, FALCK, falkclinic.com, or my name, yannivanlogum.com.
Yes. Well, that is it for now, and because of time, we're gonna let him go. But Dr. Yanni, I must say I appreciate every single time
It's
you've been
always
spending with
nice
us.
to see you, Helen.
Thank you so much, and
Yeah.
I don't know how I'm going to compensate for this, but please do send our regards to your family, and
Thank
we
you.
appreciate the fact that you took time to come here and to be with us.
It's my honor.
So those who may want to, have aesthetic beauty, rejuvenation, and all the sort, please, Dr. Yanni is the best here in the Netherlands. I assure you, because we've known you for almost how many years now?
I don't know.
Yeah, it's almost getting to
Maybe almost a decade.
a decade. Yes.
Almost a decade?
Yeah, it's almost a decade, and yet
I
you
don't
have
know.
the same face. Yeah, it's true. Almost a decade. Almost you having the same figure, looking sharp all the time.
Well, you know,
Are you injecting yourself so I can inject my husband a little bit?
Of course, I, I walk the talk.
Doc, do you also do something with the fingers?
With the hands and the fingers, yes, yes, we
Oh,
do.
do
We
you
do.
inject the fingers?
We do for the wrinkles on the fingers.
Yes.
I don't really inject there, but
Mhm.
I give peels, chemical peels.
And then they are corrected.
Yes, but with the dark skin, I'm very careful with the peels because you could get some pigmentation spots if they're not prepared properly.
Well, here we are stopping today.
Mm.
Thank you for
Thank
being with
you.
us.
Thank you.
And let's keep in touch with you.
Mhm.
And those who could not get the number correctly, please feel free again to call us. And we can always send the website and the number to you. You have the chance to improve on your looks. And thank you once again. God richly bless you.
And you too. Thank you.